much for having us here and giving me the opportunity to speak. I want to tell you a little bit about the Job Creators Network, because some of you may actually be wondering, why is a small business advocacy organization here? So we're a national conservative small business advocacy organization. We advocate for small businesses across the country for lower taxes and less regulations and more pro-growth policies. We're founded by a man named Bernie Marcus. By a show of hands, how many of you have heard of Bernie Marcus? Not bad, not bad. How many of you have heard of a little store called the Home Depot? All of you, good. Bernie is the co-founder of the Home Depot. He's 92 now, but don't let that fool you because he is extremely engaged and extremely active, and you can catch him on Fox News probably fairly often with Neil Cavuto because they're good friends. But he founded the Job Creators Network about 10 years ago to defend small business, to defend our free enterprise. And I know you're thinking now, well, the Home Depot is not exactly a small business, right? 2,200 stores worldwide, 400,000 employees, doesn't really fit the definition. Well, Bernie thinks like a small business person because he was a small business person when he started the Home Depot. He had to open that first store, right? And he knows the trials and tribulations and the challenges that small businesses face when they are trying to meet payroll and keep inventory on the shelves. So we provide, we advocate for businesses, for small businesses, and we do that three ways. We do that through our high-profile public relations campaigns, and we also do it through newsletters and an educational program called Employer-to-Employee Education. And these are nonpartisan materials, and we engage our small business owners to actually share these materials with their employees so that their employees understand how public policies impact their paychecks and their livelihoods and their families. And the issues cover everything from economics to healthcare, taxes, inflation, debt and deficit. And we get some of those small business owners who want to do it out there talking in the media about these issues because they are the best messengers. They're on the front lines. When it comes to healthcare, we actually get physicians out there talking about healthcare and what's wrong with the system and how to get it fixed. So we do look for the right messengers to carry the right messages to the public and educate, because education is key. Some of our friends have described us as the most impactful organization that you haven't heard of. You may actually have heard of us recently, just as a side note. We are the organization that filed a lawsuit against Major League Baseball when they pulled the game out of Atlanta and took it to Denver based on a voting law that, really wasn't anything wrong with it, but it's based on lies and misinformation. So we are that group that filed a lawsuit against Major League Baseball because they stole $100 million out of Atlanta and Atlanta small businesses. So let's talk about the small business community and the power of it and the size of it, frankly. So there's 30 million small businesses in this country. They employ 60 million people. So by my math, that's 90 million people dependent on the success of small business. And that's before we ever count their dependents. So we're talking about a large swath of people that we need to educate, but that we can also get to join movements and get behind very important issues like healthcare and understanding the free market and defending that free market. So why does 70% of Americans support Medicare for all, according to the polls? That is the big question. Because they're familiar with it. Grandma and grandpa are on it. Parents might be on it. Maybe you're getting close to being on it. It seems easy, just hand over a card, seems like it works, seems affordable. Health insurance is really scary. It's bureaucratic, it's like a foreign language, frankly. It's complicated to the average person. Most Americans just want things to be easy, affordable, and they want it to work. We are all in this room a little too smart. It seems all of this just makes sense to us. We're so close to it. But your average person out there really, they don't understand healthcare, and it is really scary to them. So our research, and we've done a lot of research, we partnered with an organization called, and probably all of you know this organization, Physicians for Reform, Dr. C.L. Gray. A little over a year ago, we did a nationwide study of about 30,000 Americans, and it was market research. It wasn't polling or surveying, but to find out exactly what Americans wanted in a healthcare system. And what we found is that that doctor-patient relationship is very important to Americans, and women in particular. So let's be honest, women are at the doctor more, we manage our family's healthcare, we kind of understand that foreign language a little bit better than most. And so it's that doctor-patient relationship is very important. But we have to overcome those bumper sticker terms, those bumper sticker campaigns that the other side puts out. Medicare for all, the public option, Obamacare. It all sounds very simple. And that, again, what do Americans want? They want it to be easy, affordable, and they want it to work. So what does a small business owner go through in a given day? I mean, I made a list. I mean, you guys can make a list yourselves. I just call them the chief cook and bottle washer. I mean, our members, I can't imagine their days. But there's an endless list of what they do. And one thing they're probably not thinking about is health insurance. Except the once a year when they get the bad news from their broker that their rates are going up again. Or when they or somebody they love gets sick. Or their employees for that matter. Because I always speak in terms of your family of employees when you're the owner of a small business. And that's how most of my members talk to me about their employees. They're that important to them. So how do we sell? How do we talk about free market solutions to small business owners? Well, first we have to kind of remember that they are patients too. And their families are on the plan, and maybe their family members are sick or need health insurance or need good health care. So we need to speak to them in those terms first. Secondly, employee retention is very important, and benefits, insurance benefits, health insurance benefits, overall help retain employees. There is a massive labor shortage going on right now. Probably the worst we've seen in a couple decades. I won't go into why, because that's probably another presentation. But because of that, having great benefits to offer employees helps retain them, as well as helping your bottom line. Small businesses also listen to other small business owners. They're innovative, they're entrepreneurial, they're always looking for new ideas and what works. So if you've got, your buddy that you see at the chamber meeting once a month finds a new way to do something or a better healthcare plan for the employees, they're going to want to hear about it. And that's why we really think that stories are much more important than the stats. The stats are important. We all want to know that you're going to save 30, 40, 50%. That's amazing at the end. That's the punchline. But what we do at Job Creators Network in those public relations campaigns is we get those messengers out there, the right people telling the right stories that are relatable. So when the Tax Cuts and Jobs Act was when the other side was fighting so hard to keep it from passing, we got our small business owners out there talking about not how much they were going to save and put in their pocket or buy a yacht with. We got them out there talking about what they were going to do with it. They were going to invest in their businesses. They were going to grow jobs. They were going to give raises, and they were going to increase their benefits. And the more we got them talking about it, the more people started listening. And that's how we do it. And with healthcare, I mentioned that we have physician members as well through our partnership on our healthcare plan. And we get physicians out there talking about it as well in the media. Again, the message and the stories are very important. And I think our side doesn't do as well as the other side is telling those stories. So let's look at a case study that kind of will demonstrate why it's so important to talk about stories before the stats, and particularly with educating on patient-centered healthcare and direct primary care. So this particular patient has traditional employer insurance through a big hospital system. Doctors are all part of the big hospital system, the matrix, if you will. Not a great history. Mother, grandmother, and sister all had breast cancer, all are deceased. At her annual screening, she asked for additional tests, figuring that she needs to really start taking a look at what's happening. And the doctor says, well, insurance probably isn't going to cover any additional tests for you. She says, that's okay. I'll pay for it out of pocket. I just want the tests. And so he orders the tests with the radiologist, but says, as needed. Those words, as needed, made all the difference in the world. Because as most people know, we never meet the radiologists. They read the scans and they issue a report and you get the end result. And so as needed came back as, okay, you can have it, but you can have it in 6 months. Out of frustration, she joined a direct primary care practice and met with a direct primary care doctor, shared her background, who immediately prescribed the additional testing that was necessary. A problem was discovered, a potential problem was discovered, additional testing was done, and the problem was found to be benign, thankfully, right? At the same time, the DPC doctor was advocating and recommending genetic testing. No surprise here, genetic mutation was discovered. New doctors were brought in, other doctors were brought in to consult, make some decisions on what the best option was for this patient. And of course, preventative surgery based on the history and the genetic mutation was really the only option. It wasn't a matter of if, but a matter of when. So about 2 months ago, surgery was completed. Everything is healed, and the risk of breast cancer is reduced by 95%. So a great outcome for this patient who took control of her healthcare and her healthcare decisions, and they were made between her and her doctor, the doctor-patient relationship. Who's the patient? She's me. 3 months ago when I was asked to come here, I didn't know that I would be telling this story. But I really felt like it was important. In the last 24 hours that I've been here, everyone's been talking about the doctor-patient relationship. Well, that's what we think is really important too. And that's what our research shows. But what I found, and what Steve Forbes even referenced, was that you need an advocate. And my direct primary care physician not only helped me navigate everything, but she became my advocate. And that's so important. And I think a lot of Americans don't know they don't have the doctor-patient relationship until they need it. So that's why it's important to share stories like this. By telling the stories, you can change the narrative. We need to get to the point where you save the money too, but changing the stories gets people's attention, and they're memorable. Small businesses, they respect innovation. They're entrepreneurs. They built their businesses on new ideas, and so they want to hear them. They want to hear them when they work, particularly if it's the stories of somebody having a better outcome. I think I'm going to have a great outcome. As I mentioned earlier, we've been working a lot on healthcare and healthcare reform on the policy side for the last year and a half. So we were very, very happy to meet Dr. Dale and his organization, Sedera. We think he offers a great option that's an alternative. The reality is Obamacare has been challenged 3 times in the Supreme Court. Just like Steve Forbes said, it's really hard to undo some of these things that they pass in Congress, and the tentacles of Obamacare are deep enough that they will likely never be undone. So we've got to get the folks in Washington that are still hell-bent on repeal and replace and move them to repair and restore. And the way that we do that is by finding options and working around Obamacare and creating something that 30 million small business owners and 60 million employees that work for them and their dependents want to use. Because if we can move those people and get those people on the movement to free market healthcare, then we will, there'll be nobody left in Obamacare, really. So without further ado, I will ask Tony to come up here and pass the baton.
Thanks so much. Great job.
Thanks.
I so appreciate what Elaine has shared, and particularly that you were willing to, as it were, make yourself vulnerable by telling such a personal story. Because actually there's nothing like the power of stories. We all know the saying that a picture is worth 1,000 words. And, you know, when she put up the picture based around the picture story she had already told, that she was the patient, it really brought home everything that she was trying to say about the importance for her of discovering that you really can have a real relationship with your family doctor. And that just brings it home in an incredibly powerful way. And I want to be sort of free myself to talk in a very personal way this afternoon. I also want to try and craft a story. But the story, it's hard to know where the roots of it begin. And, you know, I know many of you have taken a copy of my book. I want to tell you why I give all sorts of personal examples within that book. Many, many years ago, I had actually taken a sort of a hiatus, a couple of years off in the middle of my medical training. I was trying to figure out exactly what I wanted to accomplish. I come from a family of family doctors. My dad was a doctor. The only thing I can ever remember planning to be was to be a doctor. I wasn't going to be a jet pilot or, you know, a famous politician or anything. The thing that I saw out there and which I so admired, which I love and remember from, you know, childhood experiences. My mom and dad were missionaries out in Taiwan. My father ran a clinic there. I would go with him on, you know, house calls, 6, 7, 8, 10 years old. I'd go out with him at night, and we'd go into anything from the slums of Taipei. We were in Taiwan, so Taipei being the capital city there. We would see some of the poorest of the poor in the most distressing circumstances. And then he had patients like the British ambassador. I used to love going out to his home. It was an ancient castle that was built on the coast of Taiwan, right out where a main river through Taipei sort of ends up on the coast. And this British fort sort of represented now as the British consulate my roots and background, because my family were British. It was fun to see his Rolls Royce or to have a chance occasionally to get on their grass tennis courts. You know, kids, we remember such strange things. But what I saw, whether it was the British ambassador or whether it was the poorest of the poor in some of the slums of Taipei, was the incredible love and respect that patients had for my doctor, Dad. They loved the fact that here was a person who would go out of his way to really be available to them and to help them in whatever way they needed at that moment in time. And that, for me, began this sort of journey into medical care, and a journey through all sorts of things that I'd never expected. And one of those was that I took this 2-year gap in medical school, because right near the beginning of my second year of medical school, and this story may not make entire, you know, sense to many of you, but I'm someone who's always taken my faith seriously. And at the beginning of my second year of medical school, I suddenly realized that because I'd always wanted to be a doctor, I'd never wanted to be anything else, that I'd never actually made that a matter of, you know, how did that fit in with this sense that as a Christian, I had a call of God on my life, that I wanted to be effective and meaningful. I'd never asked God whether he wanted me to be a doctor. I just had the sense, well, I'm going to be a doctor, and God, if you've got any sort of feelings about it, you know, don't really know how you speak to us or if you do, but if you've got any feelings about it, I'm happy to serve you as a missionary doctor like my parents did, but being a doctor is non-negotiable. So, you know, all of a sudden at the beginning of my second year of medical school, I'm thinking to myself, now wait a second. If I believe any of this stuff about a relationship with God, then I don't have the right to tell him something's not negotiable. I need to actually make a point of asking him and trying to figure out what's going on. And so I took a couple of years off. And in that time, I went to a Bible school. I got involved in all sorts of things. And I began really thinking and praying through what I wanted to accomplish out of my life. And I can remember It was near the end. I didn't realize that this 2-year period was going to, have me going back into medical school. I'd been quite serious when I left, meaning I'd sold my skeleton, which now, not this one, it's still functioning. But every medical student, at least in those days, had their own real skeleton. In fact, I used to keep it under my bed in this 2 years I was away. The landlady was terrified of coming into the room that I was in, because she had found the skeleton there one day and wondered what was wrong with me. But anyway, so I thought I'd perhaps given it up for good. But as I'm thinking and praying through this stuff, I come across a really interesting passage in the Bible, and it says this. It's the Apostle Paul talking, and he says, "I'm only going to write about the things which I've personally seen and experienced of how God has worked in my life." And in the sort of way that it's hard to understand or explain, perhaps if some of you are not people of faith, into that context, I had this sense of God speaking to me and saying, "Tony, I'm going to use you in some unique ways that you haven't anticipated, and I want you to always be willing to tell the real story. Don't leave out these bits because they may not be understood or appreciated by everyone, but be honest about the journey. Because if we're honest about ourselves and about our weaknesses and our failings, what we discover is that people find it a whole lot easier to identify with our weaknesses than they do with our strengths." There tends to be, particularly, towards physicians who, tend to be highly respected folk, this sort of holding them on a pedestal of some sort. And it leaves them as very vulnerable people, because I can promise you that physicians are as damaged and as needy as anybody else in the world. And it's only as we open up ourselves and are honest about what goes on that we can communicate what it takes to actually accomplish a vision. And, on the slide that they'll put back up, it talks about the fact that we're developing a vision here at this conference. Okay? If I'm going to be able to communicate anything effectively or clearly here, it's that we would have a vision of what it really takes to transform healthcare. If we're going to bring transformation to the healthcare world, we have to have a vision of what that's going to look like. When I went into medical school, I had no idea that one day this person who was aiming to become a family doctor, and who did become a family doctor and worked for many years in London's East End. Many of you are sort of fans of PBS-type TV shows from England, a lot of the good BBC stuff. You may remember one called The EastEnders. Well, that's right where our medical practice was. And maybe you've seen more recently the Call the Midwife. That all happened just literally streets down from where my medical practice was. And all the sorts of social problems that you saw in that program, they were typical within the medical practice that I was involved in. I could have never conceived in those days that I would end up in another country, namely the United States, and that I would move out of clinical medicine and I'd find myself involved in sort of transformational initiatives with a view of altering the way that healthcare is paid for in this country. Because I wouldn't have had any idea in those days that there was actually even that much difference between the British and the American system. I think it was Winston Churchill who said that the British and the Americans are two people separated by a common language. And that's equally true in the healthcare world. We have a British National Health Service. It's socialized medicine. It was the only thing I had seen. It was the only thing really that I knew. You take it for granted when it's the only thing that's out there. But alongside what I was taking for granted of socialized medicine, I also had a picture of what America was like. And I understood the concept of the American dream. I understood that people from all over the world flocked to America because they believed that over there in America, they would find opportunity. They could become whatever it was that they wanted to become, that they would discover the sort of, if you like, the vistas that are available when you take freedom as something that really is available to the ordinary person. Now, I hadn't married those things in my mind until I found myself moving over here. I had an interesting experience just a couple of years after moving over here. One of my friends from London had come over to visit Felicity and I and our kids, and they were staying at our home. And this friend said to me this. He said, "Oh, Tony," he said, "I knew when I came, over here to the States to visit you, I knew your home would have a swimming pool." And I said, "Well, why?" And he said, "Well, you always talked about, back in the East End of London where nobody, I mean, literally, even publicly, there was only, I think, one public swimming pool that was available to our section of London. So, maybe 1 million people or something in that part of London who had access to one, large public type swimming pool. I'd always said, one day I'm going to have a house with a swimming pool. And this friend said to me, he said, "I knew when you went to America, because you're the type of person who states what you believe is possible, that in America, you would find it would become possible for you." Okay, now that in its very simplistic way sort of described my understanding of the American dream. I didn't come over here to get a house with a swimming pool. I came over here for other reasons. I actually was working with physicians here and all around the world in a more sort of academic environment where I was helping them integrate how we can really treat the whole person. And that would be, another story in and of itself. But out of that, I'd found a way in the context where I found myself to improve financially what was going on, even while trying to help other people, other physicians, improve or expand the capacity they had to really take care of their patients as real people. I picked this up, I guess, from my dad, that it would make such a difference when you allowed yourself as a professional to be deeply involved and engaged in the life of your patients. I used to, often find with my patients that, they would come with, imagine all the sorts of needs that any of us have. But when you're in a culture like the British culture, where really faith is long since a thing of the past and not something that most people are engaged with, it's really more just ridiculed within the public sort of TV or media world. Someone like me who took my faith seriously was like kind of a rarity and almost an absurd sort of specimen of what a modern professional person might be. But I found with my patients that if you had ever let the guard down and be real, they so appreciated the fact that even as a physician, when they said, "Well, the reason I'm here, doctor, is I don't know what to do with my kids. My oldest son is on drugs. And I can see it's completely messing up their life." And we'd begin to talk about, the types of things that family doctors certainly often found themselves engaged in England if they were treating the whole person. And into that comes that expressed need of the patient. And when I would then share some of the problems that I was going through with my kids, not from a pedestal of knowing all the answers, but from honestly acknowledging that I needed the same sort of help that they were asking me for, and that maybe we could learn together on this journey as we tried to help their family become something more akin to what they had hoped it would be, that was transformational in the type of relationship it produced. And it also meant that all of the ordinary physical type things that they were likely to talk about would be surfaced much more quickly because they found there was a relationship of trust there. Okay, now I think part of what's been in the process of breaking down in American society, because it's changed incredibly in the 30 years since I came here. When I moved here in '87, I would say everybody, including the American public, understood what the American dream was. I find now that the vast majority actually are almost negative, at least in the public sectors, it appears, to the whole concept of the American dream, of the fact that here is a land of opportunity where anybody who chooses to put their energy and their effort into the opportunities that are there can actually find incredible openness to be creating new and improved and better ways of doing things. And so for myself, this sort of journey into moving into American healthcare was beginning to open my eyes up to the fact that in healthcare as well, we were losing sight of the dream. Everything was beginning to be torn down rather than built up. And my own personal experience of this, again, something I describe in the book, was, getting injured, playing basketball with the kids, needing my medial meniscus repaired, and being blindsided by the massive costs that bear no relationship at all to what the surgeon told me would be my experience of the financial side of what was going on to put my knee properly back together again. And so into that context, vision begins to grow. Now, vision comes from all sorts of different directions. This quote that you can see, that you will see when I push the button, I guess, from the New York Review of Books, is from a book that a historian published last year, not writing history, but writing his own personal experience of the healthcare system. We would like to think that we have healthcare that incidentally involves some wealth transfer. What we actually have is wealth transfer that incidentally involves some medical care. Now, if you think about that as a description of what's gone on in this country, that's a tragic indictment of a system that has somehow completely lost its bearings. I can only believe that the vast majority of the hospitals that have been started, of the clinics that have been opened, of anything that you might look at, the research facilities that have created some of the incredible pharmaceutical wonders of the modern age, all of these started with good motives. Okay, but something has happened to a system, which was designed, I think, at least in the hearts of the initiators, in such a way as to serve people, that has now become a profound way of actually oppressing them. And for the vast majority of people, it's likely that whatever wage increases they might have expected over the last 10 or 20 or 30 years have been gobbled up by the healthcare system in such a way that it seems like there's a massive transfer of wealth from the ordinary person into the coffers of the medical system. And the question is, how has that happened, and why has it happened, and what on earth can we do about things like that when they happen? There's a huge shift that we need to understand, because until we understand the impact of this shift, we're unlikely to come up with ways that we can reach in and find a way to cure the system. Total premiums in the last, I think it's about 10 years that this particular slide shows, have gone up by 55%. The employee portion, what they're used to paying, has gone up by 70% over that time, while wages have only increased 19%. Now, when you begin seeing the divergence of what healthcare is increasingly costing as time goes on, compared with what's happening to wage stagnation, it's perfectly obvious why people are losing sight of the American dream. Because actually, the average person is not seeing an increase in their standard of living. This seems to be the first generation, as far as I can understand, in American history, where parents are expecting that their children might be worse off than they are, rather than taking it for granted that their children would be better off than they were. And we have to ask ourselves, what has gone wrong with the system in such a way that's the end result? Well, this is a part of it, but this is only one illustration. You could take this from any area. This is United Health's graph of their stock price over the last 10 years. Well, a little bit more than 10 years, actually, although you probably can't see the figures. In 2010 is when you get that consistent figure of the stock price beginning to climb so dramatically. The price going up from about $20 in 2010 up to over $400 now in 2021. That's a 20-fold increase. 20-fold. At a time when the quality of healthcare appears to probably be, for many people, going down, because the typical American now has a health insurance plan under the Affordable Care Act. Man, the language that is used, you talked about this bumper sticker type stuff, Medicare for all, incredibly simple concept to understand, very catchy, very attractive, very destructive. Do people really want the government running healthcare for a country when they look at, the typical result of government running anything? I come from a government-run healthcare system. I didn't realize how poor it was in all sorts of ways until I got far enough away from it that I could look back and realize, yeah, it was my patients who had to wait 6 months for an MRI. The contrast to that, to when I took my own mom, who had retired over here, by then my dad had died. I took her to see the doctor because she had developed some sudden back pain. And when we saw the orthopedic surgeon, he said, we're going to need to have an MRI. It looks like she probably has some, crushed, collapsed vertebrae. And would it be more convenient for your mom if we did the MRI this afternoon, which we could do right here in our same facility, or if you'd prefer, I could arrange for it to be done nearer your house tomorrow morning, and she could have it done then. I mean, those sort of options that the free enterprise system can provide when it's working effectively were inconceivable to a physician like myself coming from a socialized system where the government rationed healthcare effectively by just making it a limited availability so that you use time as your rationing source rather than finance and rather than the actual need of the patient. Okay, and when we begin to understand these things, we ask ourselves, well, what has allowed this incredible increase in value of the health insurance companies, of the pharmacy benefit managers? I mean, it's like weird to me that a massive health system like Aetna can be bought by the local pharmacy shop, CVS. I mean, how much money is somehow being pulled out of the system by these different components that these massive exchanges of value can come, while the very person who's walking into the CVS to buy their prescription isn't sure if they can afford their portion of it. Often not understanding that their portion, their copay for the drug, may be more than the whole cost of that drug, even though they're already paying as a family $20,000 a year for their insurance premium. I mean, it's bizarre. How often, I've had friends come to me. All of you, I think, know these same stories, but I think of a friend who came to me and said, Tony, we've got insurance, but my daughter, she's a keen soccer player. She's got an injury in her ankle. They're telling me it probably needs to be operated on. I'm finding, because I've got, the typical insurance policy that everybody does out there, I'm going to have to pay about $10,000 out-of-pocket costs tied up with this surgery. What do you think I should do? And I said, well, let me just make a couple of phone calls. And so I called the hospital and I said, well, what will it cost, for someone to come who needs this type of surgery? And I described it. But I said they're going to be a cash payer. Well, this $10,000 that he was going to have to pay under his insurance plan, so he's already paying all of his insurance premium, okay, if he just paid cash, it was going to be $3,500. His deductible was way more than $3,500. Why not just throw away the insurance policy and pay a cash price? That was one phone call, but I didn't stop there because they mentioned to me that that wouldn't include the surgeon's costs or the anesthetist costs, but it would cover the hospital facility and their charges. So I reached out, of course, to our local free market surgery center and spoke with them about it, and they said that everything all in would be $2,900. Okay, there is something wrong with a system when it can take that much money out of people's pockets while charging them more than a person who does not have insurance would have to pay to just go in and get a fair cash price. Okay, now I think there's a very, very important principle here that I'm going to come to in just a moment. But it perhaps brings me first to this basic premise that I hope I can get across this afternoon. That if we as CEOs, as influencers, as maybe physicians, leading our practice or whatever it might be, or as business owners, or, as brokers who are talking to business owners, if we can begin to understand the power there is in the hands of the ordinary CEO to bring change into the system. Okay, this is from Fast Company. CEOs have a greater ability to make change than politicians, journalists, and religious eaters. Okay, and they were commenting on, many of today's activist sort of leaders of companies. We need to rethink how we're going to change the healthcare system. And I think for that to make sense, I want to show you another little diagram, which for many of you is going to be very, very familiar. Okay, this is the graph, the normal sort of Gaussian curve. This is a typical population distribution curve of what it looks like to bring change in society on effectively any particular area. And what you see here is there's a very small percentage of people who are the innovators who create change. Okay, now we're going to come into in just a moment, I hope, an understanding of how we can begin to help people actually change, to actually bring transformation. But I want to move you back to a more theoretical question that I think we need to start with. If you believe like I do, I guess I better get myself a drink. Usually means I've been talking too much, so maybe it means I have to stop. If you believe that there's something gone completely haywire with a system that is taking money from people at their most vulnerable point, i.e., where they're likely to get sick, and enriching themselves in that process incredibly, even while the ordinary person is being kept absolutely static or level, you have to ask yourself, well, why is that the case? Okay, now, of course, you all understand, you don't have to agree with a word I say. Okay, I'm trying to be open and honest and transparent, but for me, vision comes out of sort of inner motivations that we begin to understand what's really going on in this world, in this system that we're a part of. Okay, because when I look at that growth of the value, if you want to call it, of the healthcare ecosystem, of how that has so massively grown in its value, even while the country as a whole has been sort of brought to a place of poverty, the typical person in this country with a $5,000 high deductible is essentially uninsured. And yet the average family in the country is having $20,000 removed out of their paycheck to pay for their insurance premium while leaving them functionally uninsured. Because 19 out of 20 people in this room are not going to have $5,000 of medical bills over this coming year. And yet, that's what you have to pay out of pocket before what you're paying from your insurance really provides any meaningful coverage to your healthcare needs. And I ask myself, well, what is it about a system that has allowed itself to get so out of whack? Okay, this is where you get down into sort of deep philosophic issues, which if we allow ourselves to think about them and to think honestly, are the sort of thing that actually can drive and propel us to say we have to bring change. When I see friends who are, as it were, risking bankruptcy because of illness, even though they have life insurance, and you're probably aware 50% of bankruptcies have a major medical component within them, and 80% of the people, of that 50% who are facing a bankruptcy because of a medical incident, 80% of those people actually have major medical insurance. It is not protecting people from bankruptcy. Okay, there's something wrong with that system. There's a very interesting verse in the book of Ephesians for any who have perhaps read that or are familiar with some of the writings of the Apostle Paul. But he says, we not only will not participate in the unfruitful deeds of darkness, but instead we even expose them. Okay, when Steve Forbes talks like he did earlier about some of the things that are going on in this country, what he's doing is he's exposing things that are going wrong. When we, bring to a population who come to us trusting us as physicians or as insurance brokers or as people who are providing something else within the sort of medical world, and they're coming for help and advice, there's that trust and expectation that we're going to give them the absolute best that we can. If we are not giving them the best, we're not only not exposing the unfruitful deeds of darkness, but we're actually participating in them. We become sort of a willing accomplice. I won't mention any names here for sort of obvious reasons, but a very close friend of mine was describing a conversation with a fellow resident in the ENT program that they were a part of. And this resident was just sort of raising as a question. He said, it was so weird. I had a patient come back that I saw in the emergency room a few weeks ago, and he told me about the bill he had for what happened when I saw him 2 weeks ago. He had been in the emergency room, and he, the resident, had performed a very simple 10-minute procedure to take care of an ENT problem. Hadn't been that complicated at all. 10 minutes, able to discharge the person home. And the person had received a bill for $16,000. That's evil. That's not just bad or greedy or what's gone wrong. That's evil. I think it was Keith Smith who said to me that when I realized that I was being like a financial serial killer to many of my patients, that's something that we participate in while we don't expose what's going on. And we have an opportunity to not only expose, but to transform. And if we're going to transform, I think the key person within that context is the CEO. Okay, corporations, at least for the private part of healthcare, if private is the right way, it's so corporatized, it's not really private anymore. But government, handles Medicare and Medicaid and TRICARE and all of these sort of things. So maybe about 50% of the country see their healthcare paid for directly by the government. The other 50%, the vast majority get it through the employment where they go. And corporations in that context are paying 82% of employee health insurance premiums. Why would we close our eyes as sort of influencers in the business world to the fact that we actually can wrestle this problem back down to a place where we bring transformation to the system? Okay, in an approaching $4 trillion industry, I think Steve Forbes said earlier at the lunch session that there was $3.8 trillion being spent now annually on healthcare. Okay, if 50% of that, approaching $2 trillion, is being paid for through companies, okay, why would we as CEOs not say, well, isn't there something I can do about this? I mean, if I can find a way to bring down, employee cost while improving the benefits given to them, aren't I interested in that? Why on earth is it that the average CEO has said that healthcare is so, impossibly complex that I'm going to hand it over to an insurance broker who gets paid, generally speaking, by whom? The carrier. Why would I want to have someone advising me who's paid by the very person who's picking my pocket? It doesn't make sense. And we have to start waking up, and I think for any of us who have influence with companies, and it's part of why, and in a second I'm going to come back to this for a moment, as I began to think about how do we really change the way that healthcare is paid for in this country, I began to realize that the answer lies with the CEOs. And Job Creators Network work with hundreds of thousands of those. Yes, they're small business owners, because yes, America is a nation of small business people. And the impact that could be had if the ordinary CEO, whether they're looking after 3 people or 30 people or 300 people or 300,000 people, if they said we're going to apply the same rigor to how we look for quality in the vendors and in the suppliers who take care of our employees and their health as we do in any other part of our business. I mean, the idea that we would hand over what for virtually every company represented in this room is their second biggest line item. What's impacting their bottom line? The first is probably employee wages. The second is going to be medical costs or benefits. Okay, why would we hand that over to someone else to advise us who's being paid by the very people who are being enriched through the system? We have to start bringing rational thinking to the economics of what's involved in healthcare. And so in that context, employees know that the cost of healthcare is excessive. What it needs is cooperation between the employers and the employee to say, hey guys, whatever our company claims it's doing, it's actually also a healthcare company. I think it was Warren Buffett who, in talking about Detroit and obviously the automakers, said that what they all need to realize is that they're running healthcare companies that can pay for their expensive habit through the sale of cars. And that's true in virtually every company that we are dealing with, that people are having to support an incredibly expensive model of healthcare where, historically, for reasons we don't have time to go into this morning, that companies find themselves responsible for helping their employees deal with their healthcare costs. And it becomes a drain on everything else that they want to do to create innovation and value through their company. And nowadays, there are great new approaches that people can be using. The sort of things that Jay has talked about, the way that one can be advising, larger companies on how to handle self-insurance approaches, the way that you can use the ICHRA, the individual choice health reimbursement arrangements, so that companies can essentially remove themselves from being the healthcare provider and can put these choices back in the hands of their employees, along with putting their money back in the hands of the employee. If you don't have to be spending $20,000 or something, to help an employee and their family with their health benefit costs, you can put that back in their salary packet. You can let them benefit from the growth of the company, and you can be teaching them the impact of mature personal involvement in their own healthcare needs. And that's the flip side of this coin. This isn't just an employer decision. What we need is engaged consumers. Jamie Lagarde, many of you will have met him. He's here, the CEO at Sedera. He loves to say that all Americans are born with a superpower. And that superpower is that they're incredible shoppers. So why do we turn that off in our minds on the most expensive item in most of our budgets? The typical family is spending as much or more nowadays on their health insurance premium. They may not see it. It may all, mainly being paid by their employer, but it's not showing up in their wage packet, and it's taking more money than their mortgage or car payment or any of these other things. If there's a way to bring that back down by engaging responsible consumers, then we can transform healthcare without one new law needing to be passed. If time permitted, it'd be fun to tell you about some of the sort of regulatory challenges we've faced within Sedera as we try and pioneer, new and more effective ways of helping teams in companies, find how they can handle these healthcare costs in completely different ways. But suffice it to say, working now with about 1,500 companies around the country, that we see for companies that choose to engage their employees and to actively enable them through a whole new system where people are literally sharing each other's medical bills, rather than taking that responsibility off themselves, offloading it to the insurance company in exchange for a hefty premium. Why not continue to carry your personal responsibility while joining with a community of people who choose voluntarily? Again, I think it was Steve Forbes, quoted Alexis de Tocqueville's, Democracy in America, talking about this incredible American almost obsession with voluntary association. And that's what's happening in the medical cost-sharing world, pioneered by some of the Christian groups, the faith groups that were exempted in the Affordable Care Act. They've had 30 or 40 years of demonstrating the validity of this approach. But now, since the Affordable Care Act, that whole thing has sort of exploded. What they thought, they meaning the sort of government of the day, when they provided an exemption to the Christian healthcare sharing ministries, they thought they had limited what those people were doing, the damage of these people who weren't relying on the government. They had limited it just to a few people of faith. But instead, with the impact of the Affordable Care Act, people became so desperate that there's been massive growth, not only in the faith communities, but in others like ourselves at Sedera, who are taking this model and making it available to everybody. Okay, but it's a completely different model. It's not a model where I get rid of my responsibility. It's a model where I voluntarily take that responsibility on. I actually choose to remain responsible, to remain actively engaged, to be acting as a cash payer, because I am a cash payer, but a part of a community of people who are trusting each other, that we can share each other's bills in such an effective way that we can even take care of the really big stuff. And for the last 6.5 years since we were founded, every medical bill has been paid of every size. Okay, because people can be trusted. And there are lots of people of goodwill out there. But we put in very simple and obvious little checks and balances to help make sure that things are working effectively. So, for example, we have, with every case that a person has with us, what we call an individual initial unshareable amount, or an IUA. It's a little bit like the concept of a deductible, but it's different. It's not saying, well, I have to pay this, and then, for the rest of the year, I don't have to worry, the insurance company's going to take care of it. It's saying, I need skin in the game in every case. So it might be my kid's, sprained ankle, and I take them to an urgent care, or it might be, me now with stomach pain that needs to be investigated. But every time I have a need, I want to be engaged, including financially, because while I'm engaged financially, it keeps me responsible as a person. But the IUA, this initial unshareable amount, which people can choose, obviously, how much they share on a monthly basis is dependent on some of the choices they make. That keeps their skin in the game in every medical incident that they have. But it's small enough that it's easy to have prepared for, to save up for. And then the community is going to join in and help them take care of all of the costs beyond that, because that's what we do as a community. We're committed to serving each other. And you can make these new and innovative approaches work incredibly well if you're willing to do that. Okay, we all need access to health care. Health insurance is just one way to pay for it. And I guess what I'm trying to say here, and which I'm going to close with, is the free market system provides an opportunity for dramatic innovation. But we have to choose to get engaged. Okay, this isn't just something for someone else. If all of us choose to get engaged in the sort of free market expressions that we're hearing about, then what we'll find is, working together, a rising tide really will raise all boats. But we can't just say, oh, well, I hope this approach works for other people, but, thankfully my company has got enough money, we can just afford to stay in the insurance system or whatever. We need to start talking like Harris Rosen, the founder of Rosen's Resorts in Orlando, Florida. When 20 years ago, faced with yet another raise in premium, he said, when he spoke to the insurance companies and they explained that they couldn't bring his costs down, he was just part of a big group of people and everybody's costs had gone up. When they said they couldn't help him, he said, that's okay, I can take care of this. I'm going to fire you. I'm not going to fire Blue Cross to go to Humana or Cigna to go to Aetna. I'm going to fire the system. And he brought on the equivalent of DPC. They didn't know what that was 20 years ago, but he brought on effectively an on-site clinic. He took a little room that they had been using for childcare. He hired a family doctor, and he said, let's figure this out together. We can do better. 20 years down the road, that's enabled them to give away from their resorts over $400 million in saved premium into their local community to help transform life in their local communities. And he still is less than half the cost of what most other people are paying for insurance while providing better care. My challenge to all of us is, it's time for us to get engaged. And that means each of us getting our skin in the game and not just looking at these solutions, but saying, I'm going to get involved and support these emerging solutions in such a way that we demonstrate how that diffusion of innovation curve can switch in such a way that we can transform what's going on in healthcare in this country. So Keith, I'd love you to come back up and let's take our final 15 minutes for Q&A. Elaine?
Once again, they've graciously agreed to a little Q&A. No speeches, questions. So who is first?
Hi, thanks so much for your talk, Doctor. I want to pick your brain about something as a Christian physician specifically. So I'm a PhD student at Baylor University. I'm a philosopher, but I confess it regularly. So I'm writing my dissertation about DPC. One of my chapters, I am tackling moral issues around the professional lives of physicians. There's a small but loud and popular contingent of bioethicists that argue that physicians ought not to be able to be conscientious objectors. So they're talking about abortion, obviously. I'm just wondering what you think DPC and innovative funding solutions can do for Christian physicians who want to swim against the tide and provide services that aren't perhaps professionally popular, aka not providing abortion services if they're Catholic, not prescribing birth control, things like that.
Yeah, that's a really interesting question. And obviously, any opinion I express here is my own. We come from all sorts of different backgrounds. But I think it's incredibly important that as physicians, we absolutely stand up for our right to practice medicine in the way that we believe is appropriate and which provides, full care to the life of the patient. And this is where, I touched on it briefly earlier on in the things I said, that you get into deep philosophic issues. In fact, I touch on it a little bit in the book, and I know when we leave, there'll be some of our team, and they'll be offering any of you who haven't had one yet a copy of the book. But, my experience in the UK, which is exactly where the States has also gone, is that government inevitably tries to insert itself between the physician and the patient. And part of the poverty of medical care is when physicians stop actually standing up for what they believe in. Now, obviously, the flip side of what I'm saying is physicians who believe in abortion should also have the freedom, which I think in a pluralistic society like America, they have the freedom to say, well, I think it's okay to destroy life. But let's at least talk honestly. Let's not pretend that it's not life. And so, we can help shape the conversations that come up. And there's an interesting story told. I don't know whether it's apocryphal or real. But, someone was talking in Nazi Germany of what happened. And he talked about how, in the 1930s, when the Nazis were just beginning to have their voices heard, they came for the gypsies. And he said, well, I wasn't a gypsy, so I didn't stand up for them. And then they started coming for the handicapped. And he said, I wasn't handicapped. And so I didn't stand up for him. Now, if you know the history, you know where this is going. I apologize, but I get emotional when I think about these things because it's such a short step from there to when they came for the Jews, then the Christians. And finally, they came for him. But now there was nobody left. Nobody who would stand up. And we need physicians who will stand up and who are crystal clear. And we shouldn't be ashamed. Whether you base this on biblical roots or you could base it on Greek philosophy, you could go back to the arguments that existed between Plato and Hippocrates. Physicians, for 3,000 years, until the last 20 or 30 years, took an oath called the Hippocratic Oath. And one of the first things it says is, first, I will do no harm. And it goes on to say, which means I will not do an abortion, because you're destroying that life. Okay, and as physicians, we need to be bold to stand up and say that we are there to serve the life of our patients.
Questions? Anybody else? We have wine glasses in our house on which are etched the Latin phrase "Principius obsta et finem respice," which is resist the beginnings, consider the ends. And I've thought about that with what you had to say. It's one of my favorites. That's from, I don't know who it was, the Association of American Physicians and Surgeons, that put that in their bulletin, and that really stuck with me. Questions? Oh, there's got to be questions.
Right over there.
Okay. Dr. Kendrick Johnson.
You mentioned that in England, waiting for an MRI could take months. Are there stronger examples? Because a lot of times people don't need an MRI. Are there stronger examples of what that system is missing that we could provide better with free market principles?
Definitely. They could wait 18 months for a hip replacement. I remember when I was there still practicing, so that's 30 years ago, they were beginning to talk about outsourcing, the fact that the NHS was now getting so behind on surgeries that they would let people go over to the continent and pay for it, and that the NHS would then, pay the surgeon in the continent who is taking care of it. So all you need to do is go north of the border. Read Lee Carisco's book. I'm sorry, I can't remember the title, but he's a radiologist who moved from Canada down here, and he describes the incredible contrast between the Canadian, which followed the British, and the American systems. When you have something that has endless need, healthcare, anybody who pays for it is going to have to find some way to limit that care at some point. Okay, and you can either choose rational economic principles upon which you'll do that, and we were talking, a few of us at a meal earlier this conference, and saying, as we start looking at end-of-life issues and how much money changes hands, in the last 6 months of life, nearly everything the average person has managed to save up is swallowed up by the healthcare system. That's a horrific misalignment of value. The good book says a wise man lays up an inheritance to his children's children. But unfortunately, we've stopped being wise in America, and we allow the medical system to gobble it up. And what they don't gobble up, the government now sounds like they're going to try and find a way to get their hands on. So, we have to find ways to stand up and to fight back. And I love that quote you just gave us, Keith, because it's so much easier to resist at the beginning than it is to trying to find a way to right the wrong when it's become so obviously evil. Back when I was working as a physician, we got a directive from the General Medical Council. That's the licensing body for physicians. So obviously they have the power to literally stop our ability to practice. And I was leading a Christian medical organization, and we got this thing saying, hey, we're just making this very minor change in medical ethic, but we wanted every physician in the country to be aware of it. And the issue was tied up with minors who were needing an abortion. Needing is a strange word, but who were certainly wanting one. And they said, we're going to change the rules. Up till now, if a minor even just needed an ingrown toenail operated on or whatever, it had to have permission from the parents. But we're going to change it that privacy is more important when you're dealing with abortion. And so we're going to say that the minor's right to privacy comes before the parent's right of responsibility to help look after their child. And so as a physician, you have to respect that. Well, I got this letter just like every other physician in the country did, and I sort of phoned around some of my buddies because we represented a lot of doctors, about 10% of Britain's doctors at that time. And we just said, well, we're going to write back to the General Counsel and tell them that they better start their legal paperwork because not one of us was going to obey. Now, that was resisting at the beginning. Okay, do you know what happened? We got the nicest letter back from the General Medical Council saying we had no idea that you Christian doctors felt so strongly about parental responsibility. And they said, we're not going to change what we've said, but neither will we ever bring a case against any of you. You're perfectly free as doctors to practice as you want to. Now, that's what happens when you stand up at the beginning. When you stand up at the end, you may end up in jail. Or in Germany in the 1930s, you may end up dead.
I'm curious if you'll just compare and contrast for me what your organization does, such as with maybe other organizations like you, maybe the Federation of Independent Businesses or the Chambers of Commerce. I'm trying to figure all this out because I like what you're doing, but I don't know how it's different.
So we are very different from NFIB. From what I've been told, and I actually have somebody who works for me who came from NFIB, so I have great inside information, is they really do sell insurance. I mean, they've really moved into that direction. What we're focused on is advocating for policies that help small businesses. So we were very involved in the Tax Cuts and Jobs Act in the ways that I talked about, getting small business owners' voices out there. We've been on bus tours every year for the last 4 years, traveling around the country. I had 2 buses out there in 2018, zigzagging the country, trying to advocate for free enterprise, advocate for free market principles on issues like healthcare as well as economic issues. We also have a healthcare bus as well. So we've been out there with our healthcare plan, trying to educate Americans. We are a membership-based organization. We have what I call grassroots members as well. So there are members who are paid members, and those are the ones who are much more involved and what I call our advocates. And they're the ones that we work with to get them out in the media. And a lot of these small business owners that you see in some of these interviews talking about minimum wage, talking about the labor shortages, many of those people have been my members.
We're out of time. Let's give these two the round of applause they deserve. Yes. Thank you so much.